For more on this story, I want to bring in freelance writer Dani Paradis in Edmonton. She is an assistant professor at MacEwan University. And thank you, Dani, for taking the time.
Thank you.
So you heard the minister there. What did you make of this commitment, this funding?
Yeah, I think that although I think we also heard from reporters who said, well, why wasn't this done earlier? I think it's definitely a step in the right direction where people can see some certainty, across all levels of government, First Nations, municipal government. Certainty is a very important thing for what you can count on for delivering services to your people.
What do you make of the messaging, though, that we've been hearing from the government on this file, not necessarily today, but over the long term?
Yeah, I think where there's definitely some forecasting going on. So there's been not only with the initial funding announcement, but also today talking about reform. So I think we can anticipate either some more stringent requirements, or perhaps there'll be something that will show better guidelines for what people would consider acceptable or not acceptable. A lot of advocates, including Cindy Blackstock, have really argued to keep that broad because there's many different reasons why somebody might request something, for example, a refrigerator and a generator in order to keep medication cold that needs to be cold in a place where the energy isn't reliable.
Yeah, that's a good example. And so for people who may not be familiar with it, what are Jordan's principles?
Yeah, so Jordan Principles started when Jordan River Anderson from Norway House Cree Nation in Manitoba was hospitalized. So he was a young child under 5 years old, and he basically spent his life at the hospital because there was bickering between the Manitoba government and the provincial government over who would pay for his care. So if he had not been a First Nations child, this would not have happened. This is the only group of people who get caught up in this jurisdictional funding situation. Generally speaking, healthcare is a purview of the province. So the resultant legislation is named after Jordan and seeks to equalize treatment for First Nations communities using a child-first approach.
And we heard some reporters asking about the backlog. How concerned are you about that?
Yeah, I mean, if you consider a medical need, if you've ever been through something like that, you know that time is of the essence. It's very important to get your needs met. It delays treatment, which can cause all kinds of increased health problems. So it's good to see that there has been a focus on the urgent. But yeah, I do wonder, I understand that a lot of these cases are complex, but it sounds like there might need to be more resources spent on making sure that there's not a backlog, especially if you're going to be instituting reforms, which will likely cause more confusion.
And so while the funding is needed, is it on its own a remedy? How can it help end discrimination against First Nations children who get caught up in all of this?
Yeah, so funding is a key part of ending discrimination. So communities might experience situations where it's just not easy to access services. Another example that I've heard in the past would be sports equipment. So there's often concern about fraud in these sorts of government programs, just like there was with CERB, just like there is with social services. But the answer to that is not that you can completely stomp out fraud. It's that you need to be accountable. The people who are actually delivering the service need to manage how they do it responsibly. And remember that the children are the ones who are affected here. So if you are a child looking for and you're in need of hospital services, we can't waste time with bickering over the jurisdictional difference. And I think knowing that there will be funding is a step in that right direction. It's probably not going to be enough. There's still chronic underfunding, but it's a step forward.
Dani, thank you. Dani Paradis of MacEwan University in Edmonton.